And Edwina, for you, you wanted to get involved in this. Why?
Well, this one is for Ovacome, which is ovarian cancer.
Sure.
And in 2001, I collapsed in a great heap and ended up in hospital with emergency surgery. And I had a burst ovarian cyst. Ooh. Now, mine turned out not to be cancerous.
Right.
Thank God. But I hadn't realised that I was ill before. I knew when I look back that I got all the symptoms and that I really should have done something about it.
I think, though, don't you think a lot of women, you get the sort of symptoms and maybe it's at that time of the month and maybe you're feeling a bit bloated or maybe it's premenopausal or whatever, and you kind of think, oh, well, you just sort of get on with life, don't you?
Well,
you
and also with ovarian cancer is one of those strange ones where, in fact, there's quite a lot of cases, and at the moment the death rate is too high. If it's caught early,
indeed,
if people will actually talk about it and think about it and do something about it and go and see the doctor, then it can be caught early and can be treated extremely well. So that's why we say beet.
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 This is good.
Beet.
I like beet.
Beet is bloating. You feel full and so on. Eating. E for eating. If you're not actually eating very much, you haven't got much of an appetite, but you're getting spread round the middle.
Sure.
A is for abdominal pain. If you have persistent abdominal pain, not just once, but it's
all the time, sure,
then T, tell your doctor.
Tell your doctor.
And
beet, that's a really good way to remember it, isn't it?
There you go.
B-E-A-T.
That's it. We're all wearing the colour for it today.
We are.
The turquoise.
Teal. It's sort of teal, isn't it? Yeah.
The key thing as well, the thing about tell your daughter is, you know, if you haven't got a daughter, tell somebody else, your sister, or say, I'm not feeling good, I'm not sure what it is. It may just be the menopause. It may just be that something's not quite right. Go to the doctor and say to the doctor, can I have a blood test? If the doctor sends you away with indigestion pills, I would always say throw a wobbly. You know.
Throw a wobbly.
Get a blood test.
Yeah, exactly.
And the blood test, if you have this, will show it up, hopefully, and that means then you can have treatment.
The need of dementia, isn't it? To help
it is
dementia
indeed,
sufferers.
and Admiral nurses who, at the moment, we've got about 140 to 150 in the country, aiming to get by 2026